we're going to focus on OET listening. So if you remember, OET listening is the OET listening is one of the macro skills focused in the exam. And there are three parts of OET listening: part A, B, and C. So we're going to talk more about this specifically. So here, let me just move forward a little bit. There you go. So I think maybe it will be helpful if you have a piece of paper with you and maybe a pen or a pencil. It will be helpful if you will take down notes, because these uh, these information can be very helpful not only for the test, but it's also helpful for you in your profession. For example, when you communicate with your patients or with your colleagues who maybe speak English, it could be very helpful for you. Okay. So if you remember, listening in OET has three parts: part A, B, and C. I want to tell you that in part A, it focuses more on recording patient details. And for part B, it focuses more on workplace communication. In part C, it focuses on professional development. So there are different focuses on different parts. So for today, we are talking about these three. Okay, I will try my best to dig deeper in each sub skill. But if you have any questions, please feel free to ask me. First step, we're talking about recording patient details or listening part A. Okay, but before I proceed, this is the frequent question I get from our participants. Alvin, how many questions do I need to get correct for the listening subtest so I can pass the test? So usually test takers awarded grade B from a scale score of 350 will typically have a score of at least 30 marks. So if you remember, there are 42. So it is important to note that new listening tests as well are written for each test session with the new material. So this means that the grade boundaries are adjusted slightly for each test to allow for minor differences. Okay. So again, uh, test takers will typically need to have a score of at least 30 marks in listening so that you can make it. So let me proceed with listening part A. Okay. So for listening part A, it's about recording patient details. And for listening part A, there are two 4 to 5 minute dialogues and there are 24 questions. The focus of listening part A are the following. Number one, listening for detail. If you talk about listening for detail, say in the healthcare context, this sub skill involves paying close attention to specific information or facts when you are talking with the patient. And also, another one, you need to identify and understand precise details. For example, if you're talking with the patient, or you might need to understand names, dates, numbers, specific symptoms, treatments, or procedures during the conversation. And the other sub skill is relevant information. Listening for relevant information, meaning it involves identifying the information that is important to the topic or purpose of the audio. All right. For example, the in the audio, the doctor is reassuring the patient about the disease. So there are some information there that are relevant or essential for that particular purpose. Okay. On the other hand, I would suggest that if you are doing listening part A, it's important that you also need to practice to know which are the irrelevant details or the details which are not needed, right? So those are the primary goals in listening part A. So I want to show you, Alvin, what does the exam look like in listening part A? So I just want to show you this and do a little bit of a noticing activity. So if you take a look at it, you can see that there are some patient details. For example, you got, oops, sorry. I want to zoom it in so everybody can see it. So you got the patient's name is Ray Sands, right? You got a little bit of details about the history of the patient. 18 months ago, back injury sustained lifting blank. 1 year ago, sciatica developed, and so on. There are also some details about patient description of symptoms, occupation, initial treatment, medical history, information given, and outcome. All right. So these are the information that you might see in listening part A. So, do you have any questions about the structure of the test? If you are okay to proceed, I would like you to at least click your heart button, or maybe can you please click your thumbs up buttons before I continue? All right. So it's very easy, right? So you can just see that this is a well-structured patient case note. All you need to do is listen carefully and then fill in the blanks, right? So let's try to do a little bit of practice, okay? I'm going to show you some strategies in practice, so I'll try my best to make it comprehensive. So first of all, the first sub-skill that you will need in listening, especially in listening part A, is what you call anticipation. What can you expect to hear in a consultation? I would like to bring you right now in the middle of a busy hospital. All right. Imagine that there's a patient approaching you. Oh, doctor, I'm having a hard time breathing. So if the patient is in high emotion, for example, or not, maybe just trying to approach you, what are the things that you might expect in a consultation, right? So would you like to send it on the chat box? Maybe I want to give one. For example, one example is medical history, right? So if you have any other answers, please send it on the chat box so everybody could see. So some examples are, maybe you're still thinking, for example, medical or family history. 2, recent symptoms. 3, next steps. 4, previous treatment, right? So for example, if you are in a healthcare professional and a patient consultation, you might hear details about the names of condition for medical or family history, the triggers or improvement or deterioration for recent symptoms. And for the next steps, you might hear about the tests and a referral to a specialist, right? Or for previous treatment, maybe there is a question if it's effective or ineffective, or it is about assessing the success or failure of the past treatments to inform future care plans, right? When it comes to the test, I would like to give some tips, okay? So for listening part A, it's important that you do anticipation, okay? So when you say anticipate, it's important that you try to expect or foresee what could you listen to the audio, right? Or what could the patient say? So it's very important in listening part A. Just try to do a little bit of what we call mental preparation. You need to prepare your mind. What could you hear from the audio? And then it's important, another tip, use the completed notes to help recognize what information is given. And later, we will go to that, okay? But maybe another important tip as well is use the exact language spoken in the audio as much. Actually, do not paraphrase and do not add any other words because you might lose a point if it happens. Okay. So if you have any questions, please feel free to send on the chat box. So let's do some practice. Okay. First, I would like you to anticipate some information that you need with the patient and the healthcare professional consultation. So to guide yourself, I put here some, oops, okay, sorry, something came out. Okay, wait. All right, so it's important that you try um, to look at the guide questions I made here. So before you listen to the consultation, first question, what does the doctor ask the patient first? Second, why did the patient keep a food diary? Third, which foods cause the patient the most problems? And fourth, what does the patient say she has to do to alleviate the symptoms? So I think in general terms, when you make your guide questions before you listen to the audio, maybe you can make guide questions about the healthcare professional. Like, what does the healthcare professional ask? Patient one, right? Or you can also ask more on or anticipate questions about the patient. For example, what does the patient have? What causes the problem? What does the patient do to feel comfort, right? So now listen carefully, and I'm going to play the audio and try to answer the questions.
I'd like to get some more information about what's happening with your bowels. I'm wondering if you've noticed anything which triggers the diarrhea you've been having.
Well, I've actually been keeping a food diary to see if I could pinpoint which foods are affecting me. The diarrhea flares up after I eat pasta or bread made out of wheat flour. It seems to happen quite quickly, too.
Okay.
Almost as soon as I've finished eating, I have to run to the bathroom.
So, pasta and bread made of wheat seem to be the main problems for you.
Yes. As I said, it's a very quick reaction, too. Even if I have a small portion of pasta or a single slice of bread, I get diarrhea. I get awful stomach pains as well.
Is there anything which helps lessen the symptoms?
Obviously, avoiding wheat-based food helps. But once I have the diarrhea, if I eat wheat without realizing it, I need to take anti-diarrhea pills. I'm just not happy about taking them long term, so I was hoping there is another solution to the problem.
Okay, so that's it. So I would like you to process the information. If you got the answer, please share it to us on the chat box. I encourage you to send it. But if not, just write down your answers. I'm going to give you 15 seconds. Time starts now. Okay, time's up. So as you can see here, let me show you the answers. So I think before we go there, it's important that you just try to highlight the important information that you might anticipate, right? So in the conversation between the healthcare professional and the patient, number one, what does the doctor ask the patient first? The answer there is what triggers the patient's diarrhea, right? So there are some clue words you heard earlier. For example, more information, bowels, triggers, diarrhea. So the doctor seeks more information about the patient's bowels issues, right? Number two, why did the patient keep a food diary? So if you remember, there are some clue words there such as food diary, pinpoint, food affecting diarrhea, yeah, things like that. So the answer there is which foods affect her diarrhea? And for number three, which foods cause the patient the most problems? So if you remember, there were some keywords there like pasta, bread, wheat flour. So the answer there is pasta and bread made from wheat flour. And number four, what does the patient say she has to do to alleviate the symptoms? So if you remember, there were some clue or cues there like lessen the symptoms, anti-diarrhea pills. So the answer here is anti-diarrhea pills. So those are the answers, right? I think some of you probably got it. Maybe some of you are still working on it, and it's okay because we are still learning it. So it's okay to get lost in the process. But if you have any questions, please feel free to ask. Okay. All right. So let's keep moving. So I have here another practice. Okay. This time, everybody, we have a patient. His name is Nigel McNess. So you hear a dermatologist talking to a patient called Nigel McNess. So you need to answer the notes with a word or short phrase, and you now have 30 seconds to look at the notes. Your 30 seconds starts now. Five more seconds. Time's up. There you go. So I think you've already looked at the notes. So what I'm gonna do before we listen to the conversation is first let's try to do a little bit of anticipation. All right, Alvin, how are we going to do that? So these are the notes that you will see in listening part A. So what you will do first is to take a look at some keywords for bullet one. You see, initially thought he had dermatitis or a blank. So if you take a look at it, so the word dermatitis is a symptom or a disease, right? Or a skin disease. So you got the word or. So meaning to say, probably what you're looking for here is another skin symptom. So that is anticipation. Number two, describe skin patches as thick, blank, and slightly elevated. If you take a look at it, you see the word thick. You see the word slightly elevated. What are these words for? These words are for describing what are the patches, or it's describing either the color or texture. Maybe number two is also about the color or texture. It's anticipation, right? For bullet three, patches on elbows, kneecaps, and blank. Concern they're visible. If you see the word elbow, kneecaps, these are words that are, or these are body parts that are easily seen by other people. So maybe what we're looking for is a body part that can be easily seen as well. It could be the face, it could be the hand, it could be the shoulder, maybe not the shoulder, but the arm, right? So number four, pain described as a blank, sensation on the skin. So you might see some keywords like describe, sensation. So maybe it's very simple. Maybe what you're looking for here is a description of the pain sensation. Number five, itchiness worse at night, reports insomnia because of the skin disease. So Nigel McNess feels what most of the time? So you got the word feels. So of course you're talking about description of the effect or the impact of insomnia. And number six, affects his work as a blank. So you got the word work. So what you're looking for here is the name of Nigel McNess's job, right? So it's a name of a job or name of an occupation. So this is what we call anticipation. So what you need to do is to do a mental preparation. What might you hear from the patient or in the audio? All right. So at this point, I'm going to play the audio. So listen carefully.
You hear a dermatologist talking to a patient called Nigel McNess. For questions 1 to 12, complete the notes with a word or short phrase.
So, Mr. McNess, I have your notes here, but perhaps you could tell me in your own words how the condition developed, the treatment you've had, and anything else you think I should know.
Sure. Well, I've got these skin problems which seem to be getting worse. At first, I thought I had dermatitis or maybe even a fungal infection. I'd had something like that as a child. Then I started noticing these thick red areas on my skin. They're sort of a little raised, I guess. They just got worse, and the affected area got bigger and bigger all the time. I was a bit worried that it might be contagious, you know? I was worried I'd picked up something from one of my young nieces. I see them quite a lot.
And these patches are...
They're mainly on the outside of my elbow and over my kneecaps. Oh, and on my neck.
Right.
I've been wearing long-sleeved shirts and jeans to cover them up, but I can't hide those, so everyone can see them. They're also very painful. Sometimes it feels as if my skin's burning. It's very itchy as well. I try not to scratch it, but it's almost impossible, especially at night. Sometimes it's so bad that I find it hard to get comfortable and I can't sleep. It leaves me tired most of the time, and that has an impact on my work during the day, quite apart from the embarrassment of the symptoms themselves. I'm a tour guide, you see, so I'm very much in the public eye.
Yes, I imagine that it's been difficult for you.
All right, so I'm going to give you around 30 seconds to finalize your answers on the sheet of paper beside you right now. I'd like you to write your answers there, or maybe just send it on the chat box. That would be very great. So time starts now. 10 seconds. Time's up. So let me help you with the answers. So for number 1, initially thought he had dermatitis or a fungal infection. So if you remember, Nigel McNess said fungal infection, and he described skin patches as thick, red, and slightly elevated. So this is a description of the patches. It talks about the color. Patches on elbows, kneecaps, and earlier we anticipated that it could be a body part that can be easily seen. So that is neck. So I think Nigel McNess is very conscious because maybe other people might see the skin disease, right, or skin illness on the neck. So 4th, pain described as burning. So this is a description of the pain. How does the pain like? So maybe it's burning, it's painful, right? So itchiness worse at night reports insomnia, and Nigel McNess feels what? Tired. So for number 6, anybody who got the answer? Yeah, I think, all right. Yeah, that was great. Tour guide. That was perfect. Somebody sent an answer on the chat box. So affects his work as a tour guide. It's the name of an occupation or a job. So that's it. Yeah, very good. Perfect. Well, I think I'm going to give you a hard button for following up and catching up with this. So if you have any questions, please feel free to let me know. All right. So that's all about listening for specific information. And I think before we move forward to the next sub-skill, the next part of listening part B, I would like to give a few reminders. For example, maybe you're asking, Alvin, will I lose marks for grammar mistakes in listening subtests? Because you need to write the words, right? So the answer there is yes, you can lose marks for grammar mistakes in the listening subtest. So I would like to note that it's very important that the structure rules to create sentences, phrases, and words should be evident in your English proficiency. So I just want to have a kind reminder that also take a look at the grammar when you write it. And second, Alvin, will I lose some points if I have some spelling mistakes? Well, when it comes to medical terminology, you should be able to show that you can spell words that are commonly used. But I would like to tell that actually most of the words that you need to write here are the commonly words medical terminologies, like for example, cholesterol, diabetes, hypertension, high blood pressure, yeah, things like that, but not those technical ones. Because you know what? OET can still be taken by a normal person, okay? So everybody can take it. It's just that where can we use it, right? So of course, the best person to take OET are the healthcare professionals because they can use it in the hospital. So again, I advise that we write the correct spelling, but don't worry because most of the words that are being asked here are commonly used medical words such as diabetes, cholesterol, fungal infection or infection, things like that. And what else? Another third, a common question that I usually get is, Alvin, do I have time to check my answers for the listening subtest? For example, after listening part A, the answer is yes. In OET, if you take OET on paper, that is what Vietnam Center Point offers. You will have 2 minutes at the end of the listening subtest to check all your answers for all 3 parts of the subtest. So it's important that you take a look at your answers, but take note that you will listen to each part of the test once only. So you must write your answers in the question booklet as you listen to it. Okay? So that's it. If you have any questions, please feel free to know. And all right, so we're gonna go to the next part, which is listening part B. And if you're all good, can everybody follow? If you can follow, can you please type yes on the chat box, or maybe you can click the thumbs up button. So can everybody follow there? And if you have any questions, please feel free to let me know. So right now we're talking about OET listening part B, okay? Listening part B is about workplace communication. And to be honest, this is what I like about OET because in OET, it's not only focused on patient healthcare professional consultation, it's also touching interprofessional collaboration, meaning to say it's a conversation between a doctor and a doctor, a pharmacist to a pharmacist, a doctor to a nurse to a nurse. So it's not limited to patients. Although in workplace communication, you might also hear some healthcare professional and a patient. So let's keep moving. And listening part B, workplace communication. So in listening part B, you will see or you will answer 6 1-minute dialogues or monologues. And there will be one question per recording. So the subskills that are being focused here are listening for one main point. So when you talk about main point, it's like a main idea, like what is the gist, right? Listening for detail. Second, it means that you need to listen for specific information. 3, listening for course of action, meaning to say, what are you going to do next as a healthcare professional? What is the next step, right? 4, listening for agreement. Maybe what is the agreement between the two people talking? What is the agreement between the doctor and a nurse, the doctor and a doctor? And number 5, listening for purpose. Maybe the doctor is talking about a specific treatment and you need to know what is the purpose of it, right? So those are some sub skills that we have for listening part B. And Alvin, what does the listening part B look like? Do we need to write this specific word? The answer there is, wait, let me just zoom it in. No, you don't need to write the specific word here. All you need to do is just to choose the correct option. It's either A, B, or C, okay? So this is one example. So one typical pattern is that you got the context sentence. When you say context sentence, it's you hear a nurse briefing her colleague about a patient. It's a little bit of a background about the question. And the next is the question. It's followed by a question. It could be a WH question or just a W question, or it could be a sentence that is not complete. So, for example, what does she warn her colleague about? Or it could be the healthcare professional or the doctor warns her colleague about what? So it could be just a blank. And there are 3 options there, A, B, and C. It's another example. It's pretty similar. Context, question, options. Context, question, options. Okay. So that's the structure. And now let's proceed with some strategies and practice. All we need to do is to learn more about listening part B in the context of workplace communication. So the first sub-skill we're going to focus today is what we call activating prior knowledge. So it's important that you know what to expect. It's kind of similar with anticipation, right? So when you say prior knowledge, what do you know about it prior to listening from your colleague, right? Or before listening to your colleague. So in listening part B, you might hear or you can expect to hear these things. Number 1, you might hear about handover, or you might hear about safety briefings, staff briefings, feedback sessions in the hospital, adverse incident reporting in a healthcare facility. It could be also a clinic, right? So, Alvin, what do you mean by a handover, safety briefings, and so on? Let me just give you a little bit of description. So for a handover, it means these are information or opinion about the patient care. For safety briefings, it could be a potential safety concern in a particular area. For staff briefings, it could be information to new staff, mostly, about the workplace or equipment at the hospital or healthcare facility. Feedback sessions, it could be what went well and areas for improvement. And adverse incident reporting, it could be areas of concern and actions to avoid further incidents. So these are the things that you might hear in listening part B. I hand over safety briefings, staff briefings, feedback sessions, and adverse incident reporting. So let's go with listening for main ideas. So earlier, we did activating prior knowledge or trying to think, what do you know about those information before listening to your colleague? At this point, you need to know how to get the main point or the gist, okay? It's important that you are careful about the reading time. So these are some things that I could tell you. Number one, get a general idea of the audio from the context sentence. I told you earlier, the context sentence starts with you are a blank and so on and so forth, right? You are a doctor in a hospital who, so on and so forth. Or you have a patient who, so on and so forth. Number two, read a question to understand what to listen for. And number three, identify the main point of difference in the answer options. If you remember, there are A, B, and C options. So it's important that you know what's the difference with A, B, and C, so you can easily answer the question. Practice question. For example, what does the context sentence tell us the extract is about? So our context sentence there is, you hear a hospital pharmacist talking to a patient about discharge medication. So I would like you to think about it for 15 seconds and then try to think, what do you think could be the context about? 15 seconds starts now. If you have any idea, please share it on the chat box, or you could just write it on your piece of paper, perhaps. Again, we are asking, what does the context sentence below tell us the extract is about? The context sentence is, you hear a hospital pharmacist talking to a patient about discharge medication. 5 more seconds. Time's up. So the answer here is medicine which needs to be taken when the patient goes home. I would like to highlight some clue words here, okay? So you got some clue words. For example, the healthcare professional we're talking about is a hospital pharmacist. And we have information about discharge medication. So meaning to say, perhaps we are thinking about medicine which needs to be taken when the patient goes home because it's a discharge medication, right? So that's it. And what else? So for the next one, let's talk about the question. Remember, context, question, options. Again, context, question, options. So let's go with number 2, question. What does the question tell us to listen for? The question is, what is she explaining about the pain relief patches? So I'm going to give you 15 seconds to think about it. Send your answers on the chat box. Time starts now. Five more seconds. Time's up. Any answers? Oh, I think Dungchin answered earlier for context medicine usage. Yeah, I think that was a perfect one as well. So for the question part, could you try to share your answers to us? So the answer here is, the question tells us perhaps about routine information about the medication. Example, how to use, when to replace, or how to store, etc. Right? But there might be other ways to answer this, right? It could be one of the many answers. What is she explaining about patient relief patches? So you got the word explaining. So therefore, it could be a routine information, right? Or pain relief patches. It could be how, when, and how to store, right? How to use, when to replace, and how to store. So I think we're done with the question. Remember, context, question, options. So this time, let's go with the options. So if you take a look at the options, you can see here some important words. Yeah, I advise that you need to know what's the difference between the three. So what you can do is maybe try to underline, or maybe try to, in your mind, try to see some keywords. For example, letter A, how to dispose of them safely. Letter B, how long they're going to last. Letter C, what the side effects might be. So for letter A, the focus here is more about disposal, right? For letter B, how long last. Maybe it's focusing more on longevity, or how long might it last. For letter C, what the side effects might be. It's all about the side effects. So those are the differences. So again, in listening part B, I advise that you need to understand the context. That's the setting, right? The question, and lastly, the options. Context, question, options. So right now, what I'm going to do is to play the conversation, and I want you to listen carefully and send your answers on the chat box, okay? So Let me play it.
I need to go through some important information about the patches you'll be using for pain relief at home.
Oh, yes. I'm changing from the tablets I've been taking.
From now on, you'll use a patch for several days. This will release the medication slowly into your bloodstream.
Okay.
That should help control the pain you've been having lately. There's one important thing I need to stress about what happens when you take off the old patch. After you peel it off, make sure that you fold the edges together so that both sides of the patch stick to each other.
Why is that?
The used patch can still contain some of the active ingredients of the drug, which can be harmful to children if they touch it. By sticking the patch together, you'll seal in any of the remaining medication.
Oh, right. I see.
There you go. So I'm going to give you 15 seconds to share your answers to us, or maybe just 10 seconds. Time starts now. Type your answers on the chat box. You can have a wild guess, all right? It's fine if it's right or not. At least we tried. Time starts now. Dumtrin said A. Viet said A. 5 more seconds. Okay, time's up. So let's see. So the answer here is letter. Van said A. Letter A. Yeah, I think that was great. Wait, let me just react to those who answered perfectly. I'm going to give you a clap for this. So that was awesome. So the answer here is how to dispose of them safely. So if you heard about it, there are some clue words. I advise that you try to listen carefully for some clue words. Perhaps important information, patches for pain relief, release the medication fully, take off the old patch. The healthcare professional said, what else? Fold the edges together, and harmful to children. So if you remember, the pharmacist emphasizes important information about the patches. And there was an explanation that the patches will release medication fully into the bloodstream, indicating a concern about proper use. So the healthcare professional, the pharmacist, said that folding the edges together is important to prevent harm, particularly to children, right? So the right answer here is letter A, how to dispose of them safely. Okay, so do you have any questions? If you have any questions, please send it on the chat box. Let's try another one, okay? So, but to recall, as I told you earlier, it's important that you understand the context, preparing patient for procedure, question. You need to read the question carefully, and the options. I advise that you ignore repeated words. So, because sometimes it's a little bit tricky. It's just making it more difficult to understand. So just understand what's the difference between the three. Okay, so context, question, answers, or option. So let's try to work on the options. So you can see here that letter A is focused more on dealing with the wait, let me read the context, sorry. You hear a radiographer talking to a patient about a PET scan. What is the radiographer mainly doing? Is it A, dealing with the patient's anxiety, B, checking the patient's understanding, or C, obtaining the patient's consent for the procedure? So you might see these are the differences between the option. A is focused on anxiety of the patient, B is more on understanding of the patient, C is more on the consent of the patient. So I'll ignore the repeated words patient. It's just a little bit confusing. So I would like you to listen carefully.
So now I'll tell you about what will happen during the scan. Do you know what to expect?
Not really. I'm a bit uptight about all this, to be honest.
That's okay. It's quite common to feel apprehensive. The scan itself takes about 30 minutes. An hour beforehand, you'll have an injection of a radioactive tracer into your vein. Then you'll lie on a scan table and be placed into the scanner. It's a bit like a tunnel. It's not painful, but some people feel a bit uncomfortable lying still for that length of time.
What if I get really anxious or feel sick?
If you feel unwell at any time during the scan, just press the buzzer and we'll come and help you immediately. We can see you at all times through the window over there.
All right, I'm going to give you 15 seconds to send your answers on the chat box and try to wrap up your ideas, okay? Time starts now. Please send your answers on the chat box. That would be great. Five more seconds. Tran Viet said B. Donchun said B. Fong Deng said D. B, sorry. Okay, time's up. So the answer here is letter A. Okay, so it's a little bit confusing because, yeah, maybe, again, what are the clue words there? The clue words are anxious, apprehensive, feel sick, press the button, right? And help you immediately and see you at all times. So yeah, I understand perhaps there were parts that are pertaining to the patient's understanding. It's a little bit tricky, but the one that the patient expresses is the feeling of uncertainty, right? So if you remember, the radiographer acknowledges the patient's anxiety and try to reassure the patient. So it the radiographer provides information about what to expect during the scan to alleviate anxiety. And also, if you remember, the radiographer explains what to do if the patient feels unwell or anxious during the procedure. So that the the healthcare professional can ensure the patient's comfort and well-being during the scan. So therefore, the answer here is dealing with the patient's anxiety because the patient there was quite anxious about the procedure. So that's it. Okay, that was a good one for everybody. That was a good try. I think I would like to give a heart for everybody who tried and for those who get it. And it's okay because it's a learning process, right? So if you have any questions, please feel free to send it on the chat box. Oops, sorry. Oh no, I think I gave the answer here. Okay, so I think for this one, I accidentally clicked it, but I would like you to listen to the audio still so that you could see maybe some differences perhaps or similarities. All right, so here you hear a hospital pharmacist instructing a ward nurse about a new dressing technique. So the pharmacist is telling him why the new technology is effective, how to use the new technology correctly, or who can benefit from the new technology. My bad, I showed you the answer right away. Listen carefully.
I'll give you some information about the maggot dressings you're going to use on Mr. Dutton's wound. The dressing technique is quite new, so many nurses are unfamiliar with it.
Yes, I'm afraid I don't know much about it.
Well, the evidence is out, and the maggots seem to be very effective in cleaning wounds which are hard to heal. There are two types of maggot dressings, free-range maggots and maggot bags. You'll be using the maggot bags as they're easy to use.
I see.
After placing the maggot bag on the patient's wound, cover it with a pad. It needs to be moist but not wet. Leave the maggot bag in place for up to 5 days. When you take off a used bag, dispose of it in a clinical waste bin.
Okay.
All right, so that's it. So if you remember, there are some clue words there about information about dressing technique, effective two types, easy to use, and so on. Placing the maggot bag, and so on. So to recall, the pharmacist provides information about the new dressing technique for Mr. Dutton's wound, right? And there was a little bit of explanation about the technique involves using maggots, which are effective in cleaning hard-to-heal wounds. And the healthcare professional also described free-range maggots and maggot bags. So definitely the answer here is letter B, how to use the new technology correctly, right? So that's it. If you have any questions, please feel free to let me know. I think before we proceed, that was the last example for listening part B. I hope you got everything correctly. If you could follow, could you please click your thumbs up button? And if you have any questions, please feel free to let me know. So maybe a few tips before we proceed with part C. It's important that you make use of the time to highlight, underline, or write notes. So Alvin, can I make highlights, underline, or write notes on the OET test? Well, when it comes to OET on paper at a venue, during the listening, reading, and writing subtests, you can write notes or underline information in the tests or in the test questions and text, except during the first 5 minutes of writing. So you need to make sure to follow the instructions given on the test day, all right? So I just want to give a highlight on that. And also, I think it's important to note that highlighters aren't allowed. And second, what else? I think I talked about the spelling and the grammar thing. Maybe another question. Third is, Alvin, why are various accents used in the audio recordings for OET listening? Well, if you remember, Chriselle and I told you that OET exam is a simulation or a practice of what's really happening in the hospital. So, or in the real profession. So, a range of accents are used in all three parts to reflect the global nature of our workforce in healthcare. So, Alvin, what are the main accents that we might hear? The main accents are Australian, British, American, and with other accents, including Irish, Canadian, South African, New Zealand, etc. Things like that. And what else? Alvin, number 4, maybe you are asking, where do I write my answers for listening subtests? Well, for listening part A, you must write your answers in the space provided in the question booklet. And for part B and C, what I can say is that you must shade the lozenge next to the appropriate answer. So please make sure that you shade it. And answers written elsewhere in your booklet will not be marked. So it is a good idea, everybody, to use the sample test to familiarize yourself with the different task format. Again, where can we see the sample test? You can see our sample tests on oet.com. Okay, so that's it. I think I got a question from our participants here. In part A, how many words I need to fill in the blank? I didn't see in the question. Yeah, I think we could go back with that. So I think for part A, yeah, it depends on what is really the information given in the audio. As I mentioned earlier, perhaps it's important that you try to listen carefully from the audio because sometimes it could be 2 words, it could be just 1 word. So do not paraphrase and do not add another word. And also, I would like to note that you must avoid repeating the same word because you might lose a mark for that. So I hope I answered the question. Okay, so let's keep moving. So I think we're gonna go with part C. Wait, let me just see everybody. If you have any questions, please feel free to let me know. And I hope everybody could still follow. So right now we're gonna go to part C. And if you remember, for those who have just entered right now, we're still talking about listening part of OET exam. So in listening part C, we have professional development. I'd like to make listening part C brief. So in professional development, in reading part C, it focuses more on continuing professional development. Okay. So in this part, you will demonstrate your ability to understand longer and more complex healthcare related dialogues. Alvin, what do you mean by that? It means that it could be 2 people talking or monologues, just one person talking. So in these recordings, you'll hear various healthcare professionals such as doctors, pharmacists, nurses, what else? Radiographers, and as well as patients or their relatives discussing medical topics. Okay, so let me proceed. So in listening part C, what you need to focus there are these things. There will be 2 5-minute presentations or interviews, 6 questions per recording, and it's more about listening for attitudes, opinion, and gist. Okay. For listening for attitude, it's more about understanding the speaker's attitude or tone towards a particular topic, situation, or a person. So it can be about positive or negative feeling of the speaker. And opinion, of course. This sub-skill focuses on identifying the viewpoint or the opinion of the on a given topic. So it could be, it's important to note that some opinions are explicit, meaning to say it's easily noticed by the words, or it could be implicit. It means it's hidden. So you need to look at the language choices or personal experiences mentioned in listening part C. And listening, it's also listening for gist. Listening for gist, we talked about it in part A as well, in B. So it's a little bit highlighted, but here also it's highlighted. It refers to the main idea or general meaning of a spoken text. Yeah, so it's quite common for listening part A, B, and C. So this is what it looks like. If you're gonna ask me what does it look like, so it's like a little bit of part B, but you have the context. You hear an interview with a cardiologist called Dr. Jack Robson, who's an expert on Chagas disease. And question, you now have 90 seconds to read. Oh, this is more of an instruction rather than the question. So you now have 90 seconds to read questions 31 to 36, because there will be several questions for each 5-minute presentations. Okay, so for the first 5 minutes, they're 31 to 36. So this is the example. You got a question and you got the options. And for the next presentation, it's another 5 minutes audio. So you got questions 37 to 42. You got a question, you got the option. So as I told you earlier, it could be not in a question form, but it could be in a sentence form where you need to fill in the blank. Okay. So I think I just want to highlight the language of opinions. So in listening part C, it's important that you try to highlight simple and complex expressions. For example, or you need to know, you need to recognize words like I think, I like, or I don't like, I hate, love, or for complex, I believe, my belief is, from my view, from my point of view, and so on and so forth. Yeah, or maybe you could take a look on some words like I'm convinced that, so on and so forth. So let's have a little bit of a practice, okay? It's also important that you activate your prior knowledge. So you need to know what to expect. So for example, in the context line, you have these two sentences. So what can you expect to hear when reading these context sentences, okay? I'm gonna read the first line. You hear an interview with the geriatrician called Dr. Brian Monroe, who specializes in pain management for people with dementia. So what do you think is it about? Can you tell me? Um, is it in the green box, care of elderly people with dementia who have pain? Or do you think it's going to be the blue box, discussion on the use of pain medication for older adults? What do you think? Could you try to send on the chat box? I'm going to give you 10 seconds. Is it green or blue box? 5 more seconds. So actually, the answer here is, oops, it's not. It's the green box, actually. So if you take a look at it, this option, the blue box earlier that I showed you, discussion on the use of pain, it's a little bit tricky, but this option is incorrect because it focuses solely on pain medication. But if you remember, it's more of, yeah, if you take a look at it, it's more about pain management. So meaning to say, uh, context sentence mentioned that the geriatrician specializing in pain management for people with dementia. So the discussion could cover various aspects of pain management, including non-medication strategies. It could be also psychological support or holistic care, not only about pain medication. Okay. So let's try on the second one. You hear a diabetes specialist nurse called Tim Cox giving a presentation about some research he's done on teenagers with type 1 diabetes. So you got one, research for teenagers with type 1 diabetes, or do you think, what can you expect to hear when reading these context sentences? Or blue box, challenges faced by teenagers with type 1 diabetes. What do you think? Could you write green or blue on the chat box, please? 10 seconds starts now. Time's up. So the correct answer here is maybe it's better to expect something about the green box, research for teenagers with type 1 diabetes, because this option, the second one, let me go back with the blue box. So the challenges faced by teenagers, well, this option is quite specific because it narrows down the focus to only challenges. But if you remember, it says here about some research he's done on teenagers. So the presentation could include various aspects of research findings such as treatment efficacy or effectivity, lifestyle interventions, new technologies, not only on the challenges faced by teenagers with type 1 diabetes, right? So that's it. Okay, so let's try to do a little bit of example, another practice question. What does the context sentence tell us the extract is about? So the context sentence is, you hear an interview with the dietitian called Megan Fowler, who's talking about a study of trials on the effects of omega-3 supplements. So I'm going to give you 10 seconds to share answers on the chat box. Time starts now. Could you type on the chat box, what could we expect in this context? Remember, context, question, options. 5 more seconds. Time's up. So the answer here is dietetic trials of the effects of omega-3 supplements. Right. So I think you could see some keywords there, like talking about study of trials, omega-3 supplements. So it's about dietetic, and she's a dietitian, right? And what about the question? Remember, context, question, option. So what does the question tell us to listen for? The question is, how does Megan feel about the overall findings of the omega-3 study? So I'm going to give you 10 seconds perhaps to send your answers on the chat box. Time's up. So what we're expecting here is Megan's opinion about the overall findings of the study. Remember, we got some words here, Megan feel about. So if you remember, we go back with the subskill in listening part C. It's all about opinion, attitudes, and gist. So it falls under opinion, right? So I think it's going to be our last one for tonight. So what are the main points of the difference between the three answer options? Okay, so it's really important that in listening part C, you need to differentiate. What is the difference between A, B, and C? For example, you got here, she's confident that they're reliable. She's convinced of their positive implications. She's concerned they're based on inaccurate data. So you need to feel, is it positive or negative? Okay, so for A and B, it's positive, confident and convinced. For letter C, it's negative, it's concerned about something, right? So these are only some examples on how you try to assess the attitudes in the options or the differences between the options. But these are the real options I'm going to give you now. Okay, so the options that we have here are A, their claims don't apply to fish oil supplements. B, their findings weren't confirmed by later research. Or C, those involved selected the wrong information to analyze. So I would like you to listen to the audio. It's going to be our last one for tonight.
You hear an interview with a dietitian called Megan Fowler.
Now, the earliest suggestions that fish oils might be beneficial came from studies of the Inuit diet, didn't they?
That's right. Somebody had the idea of going to look at the Inuit people living up in the far north, as they didn't have many heart attacks, and for some reason, the researchers fixed on the idea that it was the fish in the diet that was creating that reduction. So they went with that, and they did a couple of early small trials. One of them gave the subjects more oily fish to eat, and the other gave fish oil capsules. And they looked very positive, these early trials, so people got very excited about that, even though subsequent trials, and as I said, there were 79 of them altogether, subsequent trials didn't show these effects at all. It's really interesting how an idea can stick when people want to believe it.
All right, I'm going to give you 10 seconds to write your answers on the chat box or try to wrap up your thoughts about it, okay? 10 seconds starts now. Is it A, B, or C? And it's going to be our last tonight. Thank you for standing up until the last practice question. I'm seeing a few answers here. There you go. Perfect. So 5 more seconds. The answer here is time's up. Remember, context, question, answers, or options. So we got here some different focus, and the answer here is...
You hear an interview.
I wasn't able to put the right answer, I think, but the right answer here is letter... What's your answer? Wait, let me check your answers. B, von, Vutrin, Dungtrin, V. The answer here is letter B. That was correct. Yeah. So letter B, their findings weren't confirmed by later research. So let me just highlight that Megan mentions that the earliest suggestions about the benefits of fish oils came from studies of the Inuit diet. Inuit people are some groups of people, right? So she kind of explained the researchers who conducted small trials, but later on, if you notice, there were some words like even though, but subsequent trials totaling around 79 didn't show the same effects, meaning to say that their findings weren't confirmed by later research. So the answer here is letter E. All right. So yeah, I think I'm just gonna try to wrap up from this, but before we wrap up, I think I just want to show you a few tips, maybe in general, when you try to answer OET listening subtests. So these are just 5 important things to remember. So number 1, it's important that you try to listen every day. Maybe as much as possible, try to access our sample tests, test practice, or for pleasure. Okay, so you might also listen to other resources without subtitles is much better. It could be even some series or movies related to healthcare. I think could be helpful if you want to practice for listening subtests. Second, listen for 40 minutes, at least twice a week to build up the stamina in listening. It's very important. For part A, use the notes. All right. It's important to anticipate what type of word you are listening for and use anticipation as much as possible. And for part B, I would advise that you activate prior knowledge through recalling previous experiences of the same conversations, because the conversations there, as a healthcare professional, I'm pretty sure that you've experienced it. And for part C, it's important that you listen for opinion language. I think I would like to remember that opinions are not always given obviously. Some opinions are hidden, right? Or we call it implicit. So you might try to look into some language choices that will tell opinion of somebody. Okay, so I think I'm gonna wrap it up from there.